This video is made possible by our loyal Patreon supporters. Visit patreon.com/psychetruth.
Hello, welcome. Today I'm going to be working on the lovely Juliet, and we're going to be doing massage for whiplash. This is a quicker video, so it's just a few techniques that you can use if you don't have a whole lot of time. So I'm going to go ahead and dive right in. So anybody that has had whiplash, like, it's definitely like traumatic somewhat, and there's levels of it, but you never want to like go in too hard too quick when you're working on someone that's had whiplash, especially recently. So sometimes the first thing I'll do is just look at like the shoulders. I'll look at how they're holding their head, and if the shoulders are super rounded, it's kind of a clue to me that there's a lot of just the shoulders are trying to protect this SEM muscle. So a really nice way that you can go about someone that's just been in a car accident and has had whiplash is working indirectly to help things move along. So what I'll often do is I'll start on the mastoid process, and I will just kind of gradually start introducing pressure. So I just want, my client to feel more soothed by my touch than anything in the beginning. But the main muscle that I focus on when I'm dealing with whiplash is the SEM, the sternocleidomastoid. And there's just different ways to approach it. So you just have to be a little careful of direct contact when you're working on someone that was just in a car accident or has that recent trauma. So I'm literally just doing little circles. I'm encouraging this muscle to just soften and relax a little bit. And often if it's my first session with someone after a car accident, I won't work directly on the SEM. It depends on how much swelling there is and just the level of, whiplash. And also working my way down into the occipital muscles and the suboccipitals. So just all these muscles that can really hold tension, encouraging them to relax. And if there's a lot of swelling, that's a contraindication to deep tissue. So you can get a lot done without going super deep. And deep tissue isn't always the answer. I feel like a lot of people kind of think that, but it really just depends. I usually work a lot on the suboccipital muscles. If the SEM is feeling swollen, spend a little more time there. And I'm just going to do the same sequence on the right and left before I work directly on the SEM. So Julia doesn't really she has very acute swelling in her SEM, which is pretty normal. So I'm going to make direct contact. And I'm also going to walk these shoulders out a little bit just to encourage the shoulders to remind them that they don't have to protect those neck muscles as much. And I really like to take my time with this, especially the suboccipitals. It takes time for them to really respond. And honestly, if someone has more severe trauma in their SCM muscles or one of them, you don't want to overwork that area and you don't want to spend too much time. So if you have just kind of a handful of things that are really effective, 10 minutes is often, plenty of time to get what you need to done. And I'm going to go in with my oil. I want to get a nice firm grip. So I want to do some fascial work. So I'm not using a whole ton of oil. So just really encourage these shoulders to relax. This is a really nice way to the SCM muscles are a lot less taut. So if your client is experiencing a lot of pain on either the right or left, just working with the head not turned is a really good idea to start. Or just turning it slightly. Because the more taut it is, the more intense everything is going to feel. And as your client, heals and is ready for more, you can start to focus in a little bit more. This might look really simple, but it's just a really nice way to help somebody in the initial stages of whiplash. Dealing with it. And it is really important to work on the trapezius muscle as well. It's a very self-protective muscle. It can get triggered. And I'm starting to bring my stroke all the way into the suboccipitals more. And I'm working my way up. And I'm gonna just very slowly start to turn this head and can kind of access that main muscle that's affected by whiplash, that SCM. And just a really, a confident touch, but gentle to start. And you're gonna usually find a lot of trigger points in the muscle belly. So the muscle is gonna be the thickest in the middle. You can usually find some really nice trigger points there, but you don't wanna rush into that kind of work. Sometimes I'll just do some nice slow effleurage. And I'm targeting different muscles on the way down and then on the way up. So I have a really nice, it's just that upward stroke is perfect for targeting the suboccipitals more. And I'm gonna go ahead and move to this opposite side. Another approach that you can take is to kind of do both sides and then reassess, and then maybe your client, depending on what they're dealing with, might be ready for a little bit more on each side. And the whole time just making sure that her head is supported with my opposite hand so that she feels nice and secure. And if you don't offer enough support to that head, the SEM is going to be, you know, just kind of engaged in a way that's not really that great for getting worked on. And I'm going to go ahead and just wrap up this side. You might find that depending on the angle that the whiplash occurred, one side's likely going to feel a lot tighter. So if somebody has severe pain, I would never attempt a stretch on the neck, but if it's more acute, then I really like to just give a little stretch at the end. And before we finish today, I'd like to thank a few of our patrons. I'd like to thank Brendan Garrison, Omar, and Beth Miller. Thank y'all so much for your support. And that is it for today, guys. Thank you so much for joining us today, guys. If you enjoyed today's video, you should check out our Patreon page where we have some exclusive content. I look forward to seeing you there.